Good morning, everyone. My name is Daniel Smith, and as a foundation representative, I'll introduce our topic for today. In 2016, the County of Los Angeles had a computer malfunction, and nearly 2,000 women with covered California health plans who reported their pregnancies to the agency have been automatically transferred from the exchange to Medi-Cal. At the time, Congressman Amy Barra and Congressman Lois Capps sent a letter to Diana Dooley, Secretary of the State's Health and Human Service Agency, and to covered California, demanding the electronic system be fixed as quickly as possible. 6 years later, women in this low-income population are able to receive parental care for free with an updated electronic system. Now our focus is on providing the adequate postpartum care for women in this demographic and more. Today, Stella Kim is a labor and delivery nurse in Los Angeles County, is here to discuss potential services we can offer to new and experienced mothers. We have Congressman Barra with us today to hear how we can improve maternal-child health in our community.
Thank you, Mr. Smith. Thank you, Congressman Barra, for making time in your busy schedule today to listen to our community's request. My name is Stella Kim, and I am a registered nurse in the Labor and Delivery Department. We often refer to labor and delivery as L&D. I've been an L&D nurse for a little over 2 years now, and I have been cross-trained for postpartum for a little under 2 years. During this time, I've delivered more than 100 newborns and have taken care of women with a wide spectrum of obstetric complications and comorbidities. I consider it a privilege that these moms trust me to take care of them and their newborns at this very important time in their lives.
Wow, it sounds like your department is always full of smiles and happy moments.
There's some truth to that, but it's not always joyful moments. When things get bad, things can get really bad.
Tell us more about these bad situations. We assume you came here to talk to us about a problem and how we can help the community change for the better.
Yes, that's right. There's a lot of room for improvement for our maternal child units. First, I want to start by briefly explaining what type of work we do. As an L&D nurse, it's my duty to triage patients to determine if they're admitted or discharged. Once they're admitted, I'm responsible for managing their labor and assisting with the delivery of the baby. After the baby is delivered, we assist with the recovery phase, breastfeeding, and sometimes postpartum care. The postpartum period is usually defined as the first 6 to 8 weeks after the baby is born. Recently, we had a postpartum mom admitted to a hospital because she was bleeding too much 2 days after her baby was born. This patient called 911 from home and was brought to our hospital by ambulance. She had a large bath towel saturated with blood and had large blood clots on the gurney. We took her vital signs as soon as she arrived, and we immediately concluded that we had to rush her to the operating room. She received multiple units of blood, various medications, but was eventually stabilized. This was a scary moment for us, but especially for her husband, who witnessed the entire situation but was not allowed into the operating room. This is not uncommon. This is dangerous, and it can be prevented. Another preventable but unseen postpartum issue is postpartum depression. Women are screened during their prenatal, intrapartum, and immediate postpartum period. PPD occurs in about 6.5 to 20% of women, but as many as half of postpartum depression new moms go undiagnosed. One of the reasons for this barrier in treatment is the stigma that is still associated with postpartum depression. Postpartum blues are more common, occurring in approximately in the first 2 weeks of delivery, but can turn into postpartum depression, where it makes it hard for her to bond with the baby and miss out on important developmental milestones, or even turn into postpartum psychosis, where the mom is prone to hurt herself or the baby if they're not treated promptly. Regularly scheduled postpartum visits can help screening processes to prevent common postpartum complications such as postpartum hemorrhage and postpartum depression. Nowadays, we know that mental health is just as important as physical health.
Wow, I didn't know that these complications, both visible and invisible, can be so scary and life-threatening. So how can we help?
I'm here today to ask for more accessible postpartum care, and I have statistics to back up what I'm asking for. The United States has a reputation for being an advanced nation with a plethora of resources. Then why is it that we have the highest mortality rates among the top 11 developing countries? According to an article from the American Journal of Managed Care, among 11 developed countries, the United States has the highest maternal mortality rate, a relative undersupply of maternity care providers, and is the only country not to guarantee access to provider home visits or paid parental leave in the postpartum period. Currently, under the Affordable Care Act, postpartum care is only covered for a maximum of 60 days after delivery. Some of the most common causes of pregnancy-related deaths are heart conditions hemorrhages, and infections. In the US, we have an average of 17.2 deaths per 100,000 live births, but the Netherlands, Switzerland, and Germany have an average of only 3 or fewer deaths per 100,000 live births. In addition, non-Hispanic black women are 3 times more likely to have maternal deaths than white women in the US. More than 50% of pregnancy-related deaths in the US occur in the postpartum period. One of the main differences is that these other countries have a minimum of 14 weeks of maternity leave and guaranteed access to home visits from healthcare providers. As stated before, I'm asking that we make postpartum care more widely available. Currently, most of the available postpartum programs in LA, such as Mama's Neighborhood and the Healthy Mom program, are for low-income families. We're asking to make this available to women no matter their income level. Postpartum care should be equally available to all moms. Programs such as Mama's Neighborhood are available only to a limited population. Moms must be pre-registered in the program and must be at the low-income level. Although LA County has various programs such as doulas, home visits, and early childhood development programs, potential participants must be eligible for these programs to receive their benefits. We're asking that these services be available to all women, not just low-income families, for longer than just 60 days postpartum.
We can't make promises, but we will definitely look into how we can extend the coverage for postpartum care and how to make it accessible to a wider demographic, regardless of their income level.
Thank you again for your time. Quite literally, our children are our future, and I believe it is in the best interest of our community and our nation to make sure our children have a secure and stable childhood for hopes of a bright future. But how can they have stability if their moms are rushing back to the hospital with complications? I'm hoping our members of Congress will try their best to help our community get a jump start in improving the health of our moms so that they can focus on providing the best care for their children instead of returning back to the hospital with postpartum complications, separated from their babies only a few weeks after giving birth. Thank you.
Thank you.